CPR, we've all heard of it. It's what you do when someone's heart has stopped beating, and it can be the difference between life and death. In traditional CPR, we use compressions with the breaths. This technique is appropriate for anyone in cardiac arrest, to include infants, children, and adults. In recent years, there's been a lot of talk about hands-only CPR. This is a quick and easy technique to use when someone's in cardiac arrest. However, it's not appropriate for every situation, especially a drowning victim. Confused? You're not alone. Just remember, doing something is better than doing nothing. However, we want to deliver the most appropriate care we can. So how do you determine whether you're going to do traditional CPR or hands-only CPR? It starts with one question. Did this start as a breathing problem or a heart problem? McKinley. You're in a stressful situation. A million different things are going through your mind, and now you have to decide which technique you're going to use. First thing you need to do is just start with a shake and a shout to see if the patient is conscious. McKinley. If the victim does not respond, you know that something is wrong that is keeping them from waking.
Call 911.
Call 911 immediately, and if possible, send someone for an AED. Check to see if they're breathing normally. It should look like someone that is sleeping, rhythmic and non-labored. Start chest compressions. Make sure they're on a hard, flat surface. Find the center of the chest. Put the heel of one hand on the center of the chest. Interlace your fingers, lock your elbows, and push down hard and fast. At this point, we ask, did this start as a breathing problem or a heart problem? Breathing problems occur when inability to breathe creates a lack of oxygen, and that stops the heart. In most cases, children and infants have a breathing problem first, and then that stops their heart. Drowning, choking, overdoses, and severe respiratory problems start as a breathing problem that stops the heart. In these cases, traditional CPR is actually the best thing to do.
26, 27, 28.
Count to 30 compressions, then give 2 breaths. Continue the cycle, 30 compressions, 2 breaths, until help arrives.
Hey, are you okay?
Heart problems, in this case sudden cardiac arrest, is a problem with the heart's electrical conduction system. It's like a light switch. 1 second it's on, the next it's off.
Hey, are you okay? Hey, are you all right?
The victim of a heart problem may suddenly collapse, or you may find them unconscious. With heart problems, the body still has oxygen. It just needs to be circulated. These victims respond well to hands-only CPR. Continue compressions without interruption until help arrives.
3, 4, 5, 6, 7, 8, 9.
Immediate CPR can double or even triple the person's chances of surviving. To give the victim the best chance, we need to know how to pick the proper technique. So we have to ask ourselves, is this a breathing problem or is this a heart problem? Remember, the best technique for a drowning victim is always traditional CPR with the breaths and the compressions. But if you ever find yourself in doubt, you can always rely on hands-only CPR, because doing something is better than doing nothing. Now that you learned a little bit about CPR, encourage others to do the same.